Eating disorders, there are different theories behind when actual eating disorders do begin and what actually brings them about. They are so controlled by genetics that, in my opinion, they have so many roots to infancy that really a person easily could be born with an eating disorder, and it could be brought about simply by experiences that the patient even had while being an infant and how they were raised from that perspective onward. Just because the genetic components are so strong, some families have multiple family members that have eating disorders, and it's very easy to see how that is tied to genetics and how that's brought out. And as far as what usually brings out is shown to be the eating disorder that can be seen on the outside is traditionally the process of restricting calories with the goal of losing weight. So through the process of dieting is traditionally how eating disorders are initiated or started. And with that process of restriction and wanting to lose weight, the patient will go down potential different paths. Maybe they'll get extremely hungry, and then that will lead to binging processes, and then maybe go on to the binge eating disorder or bulimia disorder, which involves binging as well. Or if they restrict a lot and they have responses with euphoria, I would say that it could be, how do they come about? Is it changes? Is it brought on by how they are already as an individual? It's probably both and different for each individual person. So sometimes it's brought on by trauma, sometimes it's brought on by the individual potentially being overweight in their youth, sometimes it's brought on by a family that's very obsessed with dieting. It can be brought on by a number of different triggers.